If you're living with diabetes mellitus, you might not realize that your kidney could be a risk for developing chronic kidney disease. In this video, I'm going to talk you through a simple test which will catch kidney damage due to diabetes years before it becomes a problem, and you will be able to implement strategies to prevent any kidney problems in future. What is diabetic kidney disease and diabetic kidney health? Let's start why your kidneys are a crucial part of your diabetes journey. Imagine kidneys are like a filter in a coffee pot. Normally, when you brew your coffee, everything is kept behind in the filter side, and only thing which drips is your coffee. Clean, beautiful. But if that filter start developing tears, your coffee beans or coffee powder will start getting into your coffee. That's exactly diabetes does to your kidneys. Diabetes injure those filters in the kidney, and your body start leaking proteins, nutrients which are supposed to be held back. They start leaking into your urine, and we could measure those proteins years before any kidney disease develops. The focus of this video is to create awareness how diabetes affect your kidneys, what are the tests you could do, what are the lifestyle you could develop now, and what medication you should be on to protect your kidneys. High blood sugar damages the filtering unit in the kidney, which we call glomeruli. Over the period of time, those glomeruli get replaced with the scar tissue, and you continue to have progress loss of kidney function. And if you have other risk factors with it, high blood pressure, high cholesterol, and God forbid you smoke, you are compounding the damage. It is a slow process. It could be halted. It could be reversed. In the office, we get a lot of patients. They become overly worried about the blood test. Now, every time you get any kind of a chemistry profile, EGFR gets reported, and also there is an annotation regarding what kind of stage of kidney disease you have between 1 to 5. Most of the people can't reverse it and stop it, provided rather than worrying, they take action on it. I spent a lot of time educating patients about urine microalbumin test. Remember, we talked about the analogy about the coffee droplets coming into your coffee pot. That's exactly your microalbumin is. This is the protein which start getting filtering into your urine, and with this simple random urine test, we could measure normal level. It should be less than 30. If you have this level of microalbumin above 30 milligram per day, it means your kidneys are getting affected by the diabetes. And remember, kidneys not only get affected by the diabetes, blood pressure, cholesterol, and other factors can also affect it. It is a very powerful test, and it is a very, very helpful test. I hope you are getting urine test every year, and you are getting yourself tested, because we have very effective medications. Let's talk about the medication that can be kidney lifesavers. First class of medication is, which are most studied, and we have used it for many years, they are called ACE inhibitors or ARBs. They reduce the pressure inside those filtering unit, and if the small tiny blood vessel in the filtering unit are not under very high pressure, they are protected. They could work longer, and they have a time to reverse any damage. Second class of medication is called SGLT2 inhibitors. Those are like Farxiga and Jardiance. You will find your kidney doctor starts you on these medications, and these medications not only are helping you protect your kidney functions, they are also helping you in preventing heart disease. third class of medication is a GLP-1 receptor agonist. Those medications like Ozempic, Manjaro, Trulicity, Trizeptide, Wegovy, and Zepbound. These are the common trade names which we have been using, and people are very familiar with these medications. These medications not only helping you with losing weight, they also protect your kidney, and there is a lot of data that they protect your heart. There is another class of medication which is called mineralocorticoid receptor agonists. They also help to protect your filtering units in the kidney. Lifestyle is the cornerstone of any kind of treatment. Decrease salt, adequate amount of protein. With the advent of this animal-based protein, whether it's keto and different versions of that, people are consuming too much protein, and too much protein is like putting too much coffee in a leaky filter and lot passing through the filter. It will injure your kidneys. You don't need to restrict proteins unless your nephrologist or your primary care restricts you. Regular amount of protein, which is about 1 gram per kg, but you do not need to take extra protein. Stop smoking, take cholesterol medication. They do help. Further, start exercising. 30 minutes, 5 times a week, preferably 7 days a week, with resistance exercise 2 to 3 times a week. Sleep 7 to 9 hours. Manage your stress, and you will improve, and your kidneys will thank you. Regular monitoring and checkups are the cornerstone. Make sure you see your primary care physician on regular follow-ups the way they recommend. Get yourself screened with urine microalbumin and stay in touch with a healthcare provider. Finally, let's wrap up. Some everyday practical steps which will keep your kidneys in top shape. Make small daily changes every day, support your kidneys, stay hydrated, eat balanced diet, and move. We are intended to move. This is Dr. Kulmeet Kundlas. Like, share, and subscribe to our channel, Kundlas MD. We are dedicated to simplify healthcare and provide you with practical steps. Thank you.